I am today going to talk about the second major depression I had. This actually occurred only 3 years after the first one that I've already discussed. At that point, I was a second-year resident. I would be an internal medicine resident at University of California, San Francisco Medical Center. This time, I knew what was happening. And I actually called Dr. McClure in St. Louis, and he sent me a prescription for Tofranil and Librium through the U.S. mail, which you could do at that time, I guess. That is, write a prescription in St. Louis for out of state. I took the Tofranil and Librium for about 2 weeks, and I wasn't getting any better. I was still able to function normally, but that same agonizing despair kind of coming from the pit of my stomach, and just not wanting to go in the morning. And at this time I was on a cardiology rotation actually at San Francisco General Hospital. That involved an outpatient cardiology clinic and taking care of CCU patients in the evenings. I remember one day I was in the cardiac clinic, and I just could not make a decision. Which should be an easy decision whether a patient I was seeing should be admitted to the CCU or could be sent home. For 5 minutes or so, I was sort of in a paralyzed state of indecision. I knew what I had to do. I went up to the chief resident and I told her that I just had to leave. No explanation. Just, I'm going. And I did. I left. I went back to my apartment and I called my girlfriend. She was going to be able to stay at the apartment and feed my cat. I then called San Francisco General, SFO, the airport, and got on a 747 TWA heading east, of course, to St. Louis. Oh, I should say that before I left, I did call Dr. McClure at that point 2 weeks later and said, I'm just getting worse. Can I come over and get buzzed? And he said, sure, just come on over and we can do it as an outpatient. So flying to St. Louis, I had somewhat of a fear of flying at that time. And I remember thinking to myself, well, I'm obviously not suicidal because I'm afraid that the plane could go down. The next day I met with Dr. McClure and I had to do a few tests, including some blood work and EKG, and then went and started a course of ECT. I had 8 treatments every other day for a total of, what's that come to, almost 3 weeks. And then went home and stayed with my parents who were living in St. Louis at the time. Again, after 3 or 4 treatments, I was totally better. And actually, during those 2 or 3 weeks, I went to the library and finished writing up a research paper from research I had done in my fellowship there 2 years earlier. That paper relating to pancreatic islets, diabetes, and a drug called streptozotocin actually got published in the middle of a depression, written in the middle of a depression. I flew back to San Francisco, again on no medications because there were none that would work, and resumed my rotation at this time Moffitt Hospital, the hospital for more obscure diseases was fairly easy to rotate and actually was on a emergency room rotation, which compared to San Francisco General Emergency Room was a piece of cake. I never considered, after even the second episode, that this was going to be something that was going to be, well, I knew it was going to be chronic. I mean, it's not curable. But I had this feeling that further episodes down the road would be treated with medications as they came along. In other words, there was no fear, as there had been in the first depression. There was no fear that I was going to not be able to have a career. Thanks. See you next time. We can label this one Nathan's second depression. I'll try to put those on the links.